The Global Institute of Psychosocial, Palliative, and End-of-Life Care has made it its mission to ensure adequate access to palliative and end-of-life care throughout the world. My name is Gary Rodin. I'm head of the Department of Supportive Care at Princess Margaret Cancer Centre, director of the Global Institute of Psychosocial, Palliative, and End-of-Life Care, and a professor of psychiatry at the University of Toronto. 95% of morphine is still consumed in 5% of the world, and the remainder, particularly in lower and middle income countries, still do not have access to this kind of pain medication.
Many people are dying in pain. They're dying without access to support for their families and for themselves. And there is a global divide in terms of that access. My name is Jennifer Gibson. I'm director of the University of Toronto Joint Centre for Bioethics and an executive team member of GIPPEC. It is a divide that is preventable. It's a divide that can be bridged. It is a divide that is calling on us to respond.
Usually when people think of palliative care, they think of palliative care right at the end of life. My name is Dr. Camilla Zimmermann. I'm the head of palliative care at the University Health Network and an executive member of GIPPEC. Early palliative care is palliative care while people are still getting active treatment to treat things like symptoms, to offer psychological support, emotional support, social support for them and also for their caregivers, and to guide them through their journey of whatever illness they might have.
Palliative care is now recognized as a human right, a basic human right, by organizations such as the United Nations, the World Health Organization, but unfortunately it's still not available in most parts of the world. After much planning, the Global Institute was launched in October of 2014, and over the past year we've been working feverishly to try to build partnerships, to engage faculty, scholars, students, and to create an infrastructure for this kind of program. We've begun a number of activities already in the Global Institute. We've engaged the professional community and the public in a variety of symposia and educational conferences. We've created fellowships. We've established seed grants to fund novel and innovative research. And we've built international partnerships to establish research and education. One important partnership now is with the Beijing Cancer Center to provide training to staff in that center. And we have another project developing research and education in Kenya with the Kenya Hospice Association.
One of the things we really value is partnerships, and we see the Global Institute has a lot of expertise, has a lot of experience. Palliative care is very well developed in Toronto, where you are, in Canada as a whole. How do you develop palliative care from a high-resource country to a limited resource country? So we can share those lessons, and that is the value people like the Gary and people from the Institute bring to Africa. And it's not just learning one way, it's two-way learning. They can learn from us, we can learn from them.
My passion for GIPPEC stems from wanting to work together with an international community of experts to further research in palliative care. And this is becoming increasingly important as early palliative care is reaching center stage worldwide.
What makes GIPPEC really novel compared to other types of research centers is that the university side, we have multiple disciplines in the humanities, the social sciences, and in the health sciences. We have a finger on the pulse of what is going on at the coalface of healthcare.
We speak about the good death, even though it is a paradoxical term. But in fact, we now know a lot about what patients and families want at the end of life.
The mandate and the mission sort of started back in 2007. We've had a number of international visitors come to see how we do business here, providing end-of-life care. We've had people from China, Israel, Africa, England, Germany come and see how we do business, and hopefully taking that model back to their countries to replicate it.
Every country is a bit different in terms of what they need, in terms of palliative care and also in terms of early palliative care. But there are also commonalities across different countries. So some of the commonalities, for example, is that everyone wants to be free of pain.
When I think about palliative and end-of-life care, I can't help but think about health equity and the gaps that we currently have within our own local system and internationally in terms of access to adequate pain control and to supportive care.
This is something we can do something about. And now is the time to do it.
That means developing good research to help inform good policy and practice. It means training health professionals locally, nationally, and internationally to be able to respond. And it also means thinking about how we might be able to mobilize our service activity, our collaborations internationally, to really bring about some material change that will start to bridge that gap, not tomorrow, but today.
We have the means, we have the expertise, and the Global Institute is prepared to lead the way. We need the resources to make this happen and to make it happen now.